Welcome to Accessible, the podcast that opens the door to disability leaders and their ideas. I'm George Gatto.
And I'm Amelia Reigard.
We are doing something a little different in this special series called Voices of the Network. Over the next few episodes, we will highlight university centers on disability, which are currently facing funding uncertainty in the proposed 2026 federal budget.
We'll explore how these programs came to be, their bipartisan roots in the Developmental Disabilities and Bill of Rights Act, and the impact they have on people with disabilities, families, and communities across the country.
Through conversations with national and local leaders, trainee alumni, and professionals, we'll shed light on the real-world value of USEDS, LENS, and other DD network programs. These are stories of leadership, innovation, and impact.
Welcome back, folks. Producer Kat here to bring us into the episode. So imagine a place where healthcare, legal advocacy, and public policy come together under one roof. Makes sense, right? That's the kind of integrated support you'll hear about in today's episode. George and Amelia sit down with Maureen Van Stone, director of the Maryland USED at Kennedy Krieger Institute. We hear about what makes their center unique, from shaping policy to founding a medical legal partnership that protects and advocates for people with disabilities. This episode is all about the power of collaboration and how working across systems creates real impact. A quick note, as of this recording, Congress is still in the appropriations process and funding for USEDS is at risk. You can help protect the future of disability services, research, and training by contacting your members of Congress today. For the latest policy updates and information on how you can make a difference for the future of disability programs like ours, visit the link in our show notes.
I am really, really excited to have you here because for so many reasons, but one of them is that you have a little bit of a different, you guys do things differently or do a different thing than we do. And one of the things that we've talked about in previous conversations is this thing that we all hear about. If you've seen one, you said, you've seen one, you said. And so, you guys are number one, I think, not actually in a university. So maybe talk about that. And then also you have sort of a really, I think, important sort of niche within the disability work. And so I don't know, you can jump in anywhere you want there, but talk a little bit about the Kennedy Krieger Institute and your USED.
Sure, absolutely. So Kennedy Krieger Institute is its own independent nonprofit 501c3 sort of standalone organization, which has entered into a university affiliated agreement with the Johns Hopkins University. And so all of our faculty across our organization, Kennedy Krieger Institute, are generally faculty in one of the schools within the Hopkins system. So the School of Education, the School of Medicine, or the School of Public Health. So Hopkins, interestingly, does not have a law school, and I am a licensed practicing attorney here in Maryland. So my faculty appointment is in the School of Public Health, which is probably sort of the best, most natural fit for the work that I do in relation to the overall university and their faculty appointments. So while we are affiliated with Hopkins, Kennedy Krieger is its own sort of standalone entity and organization, which is confusing to the community at large. In general, they usually think we're all within the same system. So I think the uniqueness about our USED in particular is that we're housed within an organization that is also home to the largest LEND program in the country and also to an IDDRC. So under one roof, we have all three of those federally funded programs working on and behalf of people with intellectual, developmental, and other disabilities and their families. So that gives us sort of a unique situation. As well as I am the only current USED director who is a licensed attorney. And so our USED certainly has, I would say, much more of an advocacy and public policy focus than I would say many of the other USEDs across the country. And usually, I think, USEDs are sort of created and led by the experiences of their leadership team. And so I would say certainly that is true in our case. I have been practicing law in the state of Maryland since 2005, and I have a team of attorneys that we can talk more about in a few minutes. But we are very heavily focused in advocacy, policy, and civil legal services on behalf of people with disabilities and their families.
That's really interesting because I know that, here at UMKC, we're obviously in the university at our Missouri USED, and that sometimes that being a university employee kind of impedes our ability to do kind of advocacy at a policy level, right? So we do a lot of community education and those sorts of things. And so because of the unique setting for Kennedy Krieger, you guys are able to do advocacy at the policy level. Are we talking more policy change through organizational and systems change?
So at Kennedy Krieger, we have an internal state lobbyist that I work very, very closely with. She is on staff at Kennedy Krieger, and she leads our efforts at the state level. In Maryland, it's unique. We have a 90-day legislative session. So it runs the second week of January to the second week of April. So everything is pretty truncated into a short period of time. And I work in close collaboration with her. I will write letters of support for proposed legislation that impacts people with disabilities and their families. I will write letters of opposition. We will provide letters of information, or we'll sign on to a number of coalition or task force letters throughout the legislative session. We will meet with elected officials in collaboration with people with disabilities and their families, as well as testify, in person in Annapolis, which is our state capital. And at the federal level, we do meet with members of Congress as needed on various issues, but we're not lobbying per se, right? We're just educating. And so that's the distinction. We've created resources and materials to educate our staff and our trainees about the differences between lobbying and educating. And we've also developed, in consultation with our LEND program and our government relations office, we have created a pretty cool advocacy curriculum that we're implementing. We just completed our third year of implementing that curriculum. And it's an opportunity for staff members and trainees across our organization to learn more about advocacy through what we call lunch and learn sessions that we host monthly. And folks can join as many or as few as they like. And then they have the opportunity to participate in something called Maryland Developmental Disabilities Day at the legislature. So each year, our LEND program and our USED co-sponsor an opportunity for staff members and trainees and self-advocates to descend on our state capitol and to engage in a rally and to participate in legislative meetings. And then we host a lunch and learn with leaders from AUCD, our parent network, the Association of University Centers on Disabilities, leaders from a cabinet level department we have here in Maryland called the Maryland Department of Disabilities, and then self-advocates from People on the Go of Maryland, which is Maryland's largest statewide self-advocacy organization, which is affiliated with our USED. We serve as the fiscal manager and administrator of People on the Go. So we create these opportunities for staff members and trainees to get engaged in advocacy and to participate to the extent appropriate based on their discipline and their clinical loads and, permission from their supervisors and all of that. But we really wanted to create a platform for giving them those opportunities if that's something they're interested in.
Yeah. You mentioned that you guys, and I think you're one of the few, I don't think there are that many organizations that have all three of the university centers, including the USEDs, the LENDs, and the IDDRCs. Can you talk a little bit about about that? Like I think of Kennedy
Yep.
Krieger and I think, oh wow, there just must be this intellectual, depth and all kinds of interesting things happening there because people are collaborating. Can you just talk about how you guys do work together and what that's like being in the same building?
Yeah, absolutely. So, um, in terms of the three programs, we leadership from all three federally funded programs, we meet on a quarterly basis. So we are in contact at least once quarterly in terms of strategizing and looking for opportunities and discussing partnerships and the landscape and all of the things. But those are sort of formal, structured meetings, but we are in constant communication. I serve on the executive committee for our IDDRC. I am Lend faculty. I teach three core courses each year in our core course curriculum for our Lend trainees. One of my staff, who is the MSEX community advocate, serves as the faculty advocate for the Lend program. Dr. Mia Sada, who is our vice president of training and our Lend director, and I meet monthly and talk about ways to collaborate. This advocacy curriculum is a great example. We developed it 3 years ago. We've been implementing it. I should mention we implement the advocacy curriculum from September through April. So with increasing exposure to different activities as people become more comfortable in that space. And then for the MSED, we have a quarterly newsletter that we have devoted a portion of our newsletter to something we call the IDDRC Corner. And so that's an opportunity for researchers across our organization to be able to share the research that's happening through the IDDRC with the community at large. So our mailing resource list goes to, thousands of people across the state of Maryland. And so we see this as a unique opportunity for Marylanders who don't necessarily live in Baltimore and the central region here to have access to know about research opportunities and what exists across our organization. So we have very, I think, strategically come together and figured out what are natural ways for us to partner and be able to leverage. And our USED hosts something called the Resource Finder Resource Center, which is both a physical space in one of our outpatient buildings as well as an online presence. And the program coordinator for the Resource Finder Center has access to patients and families who are looking for resources, information, materials. And so she is funded by our IDDRC to help get that information out about participation in research studies. So we've really tried to coordinate efforts so that what's happening, in our four walls is known to the community at large and provides an opportunity for their participation.
Wow. That's very neat. It sounds like both with talking about your three centers kind of being under Kennedy Krieger and then also talking about some of the things you guys are doing in advocacy and education, you have such well-defined pathways for information to travel, right? Like for people to know about research opportunities to get involved, and then also like a direct pathway for the results of those research and your programs to inform and impact policies in communities and people's lives. Like that sounds like such an efficient and amazing setup.
So I would love to hear more about the curriculum, on the advocacy curriculum. But when you think about you said, Maureen, and sort of where you have the biggest impact in your state, is that where it would be, or where would you say you guys are really impacting the state?
I would say it's one of our signature community-based programs, which is Project HEAL, which stands for Health, Education, Advocacy, and Law. And Project HEAL is our comprehensive medical legal partnership that I founded in 2005. It initially started as a postgraduate legal fellowship that I earned for 2 years. It was just me, just the only attorney. And it has grown. Now we have a legal director, Mallory Legg, who started out as a trainee with me in 2013, and she's stayed on for 4 semesters as a trainee and then graduated and became a staff attorney, and now she's the legal director. She has 3 full-time staff attorneys who work for her, and she has 2 contractual attorneys who work for her. And our team of attorneys engage in advocacy and civil legal services, particularly representation in both special education matters and SSI and SSDI appeals for our patients and their families. And then we have 1 contractual attorney on staff who exclusively deals with our young adult patient population. So those who, maybe started as an infant or a toddler or, a young child at the Institute and has sort of grown through the Institute over the years, who then reaches the age of majority, which in Maryland is 18. And then they need access to either an advanced directive, or under Maryland law, we have an advanced directive for mental health, or a statutory power of attorney for financial decisions, or they need, in limited cases, adult guardianship is the appropriate route. And so we have 1 attorney dedicated just to providing civil legal services for those patients and their families. So I think our greatest impact is really directly through Project Teal, and we have created a model that provides direct representation, what you would think of as an attorney-client relationship. So the individual or their family is retaining Project Teal for civil legal services. Then we also provide limited representation, which we describe as like an hour or less of a legal service. So reviewing a document, ghostwriting a letter, providing a family with a pro bono referral in the community or resources. And then we provide case consultation. So this would be anyone from across our organization, faculty, staff, or trainee, who reaches out and says, I'm working with a patient who reports they're being bullied in school. They live in X county. Can you please advise us on how to have the family reach out to the school administration or the central office to help resolve this? And so we count those as consultations directly with our providers. And then we do training, both professional trainings for other lawyers in the community or specialty groups. So if they're parent support groups or local school systems. And then we do community-based training. So for individuals and families who have, a specific topic area that they want more information on. So next Monday, I'm doing a 3-hour training on discipline of students with disabilities in Maryland public schools, and targeting an area where families are really lots of times crisis because their child is being suspended or expelled or having early dismissals or informal school removals. And so we're addressing that need by offering this community-based training. So I would say our biggest impact is through Project Heal and providing advocacy and legal services to Marylanders with disabilities, whether they're children or adolescents or young adults.
Maureen, could you talk a little bit about how that's different than kind of standard practice? Like you mentioned working with patients, so I'm assuming these are individuals maybe that you're getting connected with through like Johns Hopkins and those type. Where are the patients coming from? And then like, how is this different than kind of what people are standard practice is, and what's innovative about it, basically?
Sure. So we are like essentially a really efficient legal service model. So all of the attorneys are employees of Kennedy Krieger Institute. We all have access to Epic. We are in the physical location of our outpatient clinical setting. So unlike a family, for example, in Missouri, who has an outstanding special education issue, they may be receiving clinical services, somewhere. They may be receiving community-based services somewhere, but then they may need a lawyer. And then that lawyer would need to access medical records and speak to clinical providers and help them with their appeal if they were denied a public benefit. We're all within the same organization under the same roof. So the efficiency and effectiveness of our legal services is sort of unmatched in that we do not have to go through submitting things for, getting access to documents and all of the things that, I mean, everyone signs releases and we go through, traditional appropriate legal documents that are required, but we're really like, I can just pick up the phone and call the provider like from my desk and email them, and referrals are coming. Kennedy Krieger has over 80 outpatient clinical departments and programs, and we have um, 3 inpatient units. And so we have to see 28,000 unique patients each year. So the need of our patient population far outweighs our legal capacity, but we do the best that we can to take the cases that need our support the most. And then when we can't actually open a formal case and enter into that attorney-client relationship, then we provide them with a limited representation, which again, I mentioned is like an hour or less of a legal service, or refer them to partners in the community, either private attorneys or law firms that handle, whatever the case type may be. But I really think us being embedded into the clinical departments and programs, we are like a part of the infrastructure. We push into different medical clinics. We push into their staff meetings. So there are some high flying clinical departments and programs that see patients that have lots of need. And so we know that automatically, and we've developed a model where we automatically push into those and offer real-time advice to the clinical providers about their cases and what they're hearing in clinic, and steer them in the right direction.
Do you, when we think about our USED network, we have the USEDs, the DD councils, and then the protection and advocacies. Do you guys is the protection and advocacy in any way engaged in this, or how do you engage with them as you said that's so focused on policy and law?
Yeah, so we work very, very closely with our PNA Disability Rights Maryland. So we're on coalitions with, in fact, we had a coalition meeting this morning. So we specifically work really closely with our education unit, because we primarily, 3 of our 5 attorneys are doing mostly education work. So we work very closely with the PNA's education unit, but across the organization, we're closely connected. We participate in these coalitions. There are 2 major coalitions in Maryland. One is the Education Advocacy Coalition, which is led by our PNA. And then the other is the Coalition to Reform School Discipline, because we have a lot of discipline-related issues that are happening across the state. And so we all work collectively on behalf of children and families through those coalitions. And really, as I mentioned, like the number of patients and families that have legal issues at Kennedy Krieger outweighs our capacity. So if there's a case that that aligns directly with our PNA's priorities, they do their own needs assessment and create their own priority areas, we'll refer directly to the PNA, and we won't keep that case ourselves. On the flip, if the PNA gets a case that is a Kennedy Krieger heavy hitter, this patient is being seen across different clinical departments and programs, they'll refer directly to us. So we have this great sort of relationship where we're giving appropriate referrals to one another. And Project HEAL will be celebrating its 20th anniversary this fall. And so we've been around for a while, and we've figured out how to coexist in this space and figure out the right balance, and how to create space for both of our different programs, honestly.
Wow. Well, congrats on 20 years. That's amazing. And just sounds, it's so responsive to like the needs of the individuals that you guys are seeing that. And I feel like this comes up a lot across different projects that we have too, where it's like the focus might be something like health, right? Or access to healthcare, but that the needs that person experience are in all these different facets, right? Like employment related needs, education related needs. And so just having that legal advice and arm and to be able to do that advocacy and help meet other people's needs really looks at that whole person or the whole family.
Yeah. So Maureen, like what, obviously the big beautiful bill passed, and at least for now, we know that it eliminates funding for USEDs. If that sticks, what will happen to these programs in Maryland, and how will you keep going, or what? I mean, it's what would be lost, I guess.
Yeah, I mean, we use in Maryland, so our core funding from the Administration for Community Living, I allocate across all of our different, so we sort of divide our work into three buckets. Program, so Project Teal, as I described, is a full-fledged program, been around for 20 years. It's fully staffed. We have projects, which are shorter term, maybe projects that have 1 or 2 years of funding, stable funding, and sort of short duration, but maybe high impact. And then we have activities that we do. And so I've sort of divided it into those three buckets. For all of that work, I have spread our core funding across all of the staff who are responsible for implementing those programs, projects, and activities, so that the burden of losing our core funding wouldn't impact 1 or 2 people or 3 people. It's really spread across, but it would be really significant for us. Because of the threat of, not having our core funding, we have been applying for and fortunately received just notification last week, 2 additional state grants and contracts that will help leverage some of our work. We have renewed existing state grants and contracts with various state agencies. We've been constantly looking at opportunities for increased foundational support and working with local and national foundations to support our work. Really, I've been trying just to leverage funds and to make sure that we're braiding funds so that the impact isn't felt by any one program, project, or activity, or any particular staff. Now that's what I'm doing. I hope it is successful. Who knows? But I do think losing our identity as a USED would be very, very difficult for us. I think that's very much how we're known across our organization as our USED, and that's our recognition. And I think we've been able to leverage being the USED to create opportunities for partnerships with our state agencies who are looking for partners, and they're looking specifically for the USED. And so I think that would be significantly impacted if we were to lose that core funding.
So, Maureen, in addition to being on being the director of the Maryland USED, you are also a member of the board of directors for our national organization, the Association of University Centers for Disability. What are you hearing about the impact nationally, like through your work on the AUCD board? What are you hearing about what different USEDs are doing, and LENS, and what is any advice that you have for us as we move forward in sort of these uncertain times?
I think so. In addition to my role as serving on the AUCD board of directors, I also serve as our policy co-chair and have been in that position for over 5 years. And I think I hear the most in that position, in that role, through the policy committee meetings. I think there's a lot of fear, a lot of uncertainty. I think a lot of directors are considering really difficult decisions around laying off staff, cutting staff positions. I think there's a lot of uncertainty, particularly for those that are housed within universities, and knowing what that will mean if they lose their core funding, and how that will be absorbed, if it will be absorbed by the universities. I think, the one thing that seems to be important right now is, what you guys are doing, for example, telling the stories, right? Making people aware of what USEDs do. And many, are behind the scenes and they're not really forward facing. And so there's a little bit of risk when they're not prominently known in the community. And so making sure that, and it does take time to tell your story, right? There's not a lot of time in the normal workday to figure out, oh, how can we market this, or how can we engage in public relations around this really significant work that we're doing? And I think for lots of directors and leaders across the network, those sort of they just get pushed down because you got to accomplish a certain number of things in the day. And I think now is a time to pivot from that and to really figure out how to prioritize the messaging, how to engage in public relations. Yeah, I'll give you an example. Today, I got a text at 2:40 from our director of public relations asking me to do a spot with one of our local media networks, a 10-minute interview at 3 p.m. And the text came through at 2:40. No, that wasn't ideal, but absolutely it was necessary. We launched a curriculum on July 1st in partnership with the Maryland Department of Health, specifically the Behavioral Health Administration, where we created modules for Maryland families raising children with disabilities. And it's part of a larger online curriculum. But we took experts from across our organization and created short videos, 15 minutes or less, on a variety of different topics. So healthcare, legal services, systems of care, receiving a diagnosis, and what to do. And we've created all these modules. And the media outlet wanted to spotlight it tonight on the air, news outlets. And so, of course, I just stopped everything and took the call, right? I think that's something we have to be ready to do and willing to do, because now more than ever, we've got to get the message out that the work we're doing behind the scenes has an impact across our states and in families and with community partners. A lot of us are doing really great work with community partners, and they may be the face or the messaging that's out there, but we need to sort of underscore the role that the USEDs play in doing that.
Right. Yeah, I think that's great. And it's so, I mean, I don't know. I think it's really neat that you have someone on staff who's helping promote that for you. And
I was just going to echo something you said earlier, Maureen, about the value of having that USED designation and also the network that we form across the United States, and just being able to learn from one another and hearing about Project HEAL, and that network of USEDs across the country are always sharing what we're learning, what we're doing in our research, what projects or programs have a lot of promise, and that the work that you're doing in Maryland has impact across the nation as we learn from you, right? And as others learn from things that are happening here in Missouri. And so I think that's just one other way that the USED designation and the network that's brought together by that designation has a lot of impact.
Yeah, no, and to that point, I mean, we are part of our USED is part of a National Center for Dignity in Healthcare and Community Living for People with Disabilities, and that is an ACL funded program that created this. The grant has gone to the USED in Cincinnati, but there are a number of partners across our network, including the MCED, the Maryland Center for Developmental Disabilities, including Georgetown USED, Morehouse School of Medicine, and the Autistic Self-Advocacy Network. And we are ending our year 3 of funding for this national center. And it has really brought together, some of our USEDs to engage in this really important work. And we still have 2 years to go. And so I think the threat of the USEDs losing their funding or being eliminated from the budget, puts all of that great partnership and collaboration and work at significant risk, right? Because if any one of our universities or organizations say, well, without your funding, your USED isn't going to exist, I mean, that puts everything else at risk through these large, and there are tons, this is just one example that I'm, working on right now, but I mean, there are tons of those collaborations that are occurring across our network. And I think, it puts everyone at risk.
Yeah. Well, that kind of points to that whole thing, that we've talked about with other USED directors in particular, is that, if you look nationally, for every $1 of core funding, our USEDs are leveraging another $17 of funding. And so I worry that would be lost, or that leveraging ability, if we are no longer the USED. But all right, Maureen, if someone wanted to learn more about you in particular, or about the MCED, the Maryland Center for Developmental Disabilities at Kennedy Krieger, where would they go, or how could they get in touch with you?
So, I mean, certainly anyone can reach out to me directly. It's just my last name, Vanstone at kennedykrieger.org is my email. We do have a website that spotlights all of our programs, projects, and activities, lists our leadership of our center. And then, of course, on LinkedIn, I know a lot of network folks connect via LinkedIn, which is also, I think, another great resource. But I'm happy to share information, resources, or connect if folks are interested in partnership or thinking about ways to leverage what they're doing in their states based on what we're doing in our state. I'm more than happy to have that conversation.
That would be great. I'm curious, how would the work that you're doing from the HEAL project, is that transferable to other states?
Yeah, absolutely. And it's sort of frustrating to me that no one has replicated it. I mean, we really have packaged it in a bow. I am ready for another USED to do this. We had met with several. We've done some technical assistance visits with a couple of USEDs who had attorneys on staff or hired an attorney thinking that they could do it. And it's been unsuccessful, but I would love it. I think it would be really outstanding if we could have a USED network that had multiple medical legal partnerships, because, we've figured it out the right formula, knock on wood, now 20 years in. It's not easy. It's really not, but we've done it. And I think that, we would love, we're actually at the end stage of drafting a hopefully peer-reviewed journal article that we want to publish later this year that sort of sets the stage for how folks could do it. And we really include all the variables and the evolution of our program over time. I mean, we started small. We started with one really legal area, which was special education law, and we've grown to meet the needs of our patients and families. And so we can sort of talk about, or in the article, we talk about how we've evolved and how we've changed to meet the needs, and how others can do it too. So yeah, I would love to see another USED replicate our model. That would be like a dream come true for me.
That's awesome. Well, hopefully this podcast will help get the word out. And George, you got to write up a job description and post it later today. No, but I do think, Maureen, that thinking about starting in one area, a high area of need like special education, is interesting. Here in Missouri, there's a real high need around guardianship issues. So that's just, we got to find our in and then go for it.
Yeah. And it's interesting. Our expansion into guardianship was launched by an anonymous donation. What I suspect came from a parent who struggled to obtain access to legal services and to figure out how to navigate the guardianship space. And so initially, we just got a small chunk of money, and I found a disability rights attorney, and I said, I can hire you for 10 hours a week or something or less. Can you do it? And that's how we started in that area. Just a little chunk of money, and then we've gotten additional grants, and we've gotten a foundation grant, and we've been able to expand and grow that work. But it just started with a little bit, and it gave us enough to dip our toes in the water and see what was the need. And there is a lot of need across our organization. So it doesn't take millions of dollars to do this. And so just being brave enough to sort of take the first step, I think is important.
Yeah. Excellent. All right. Well, thank you, Maureen. We appreciate your time.
Oh, you bet. Thank you for having me.
Thank you for listening to this episode of Accessible. Accessible is hosted and produced by George Gatto, Amelia Reigard, and Catherine Toller from the University of Missouri, Kansas City Institute for Human Development, which is the home of the Missouri USED. Accessible is a joint project between the Missouri USED and the Missouri LEND program, which is funded by the Health Resources and Services Administration of the U.S. Department of Health and Human Services through grant number T73MC00022. Episodes of Accessible are released every 2 weeks and can be found wherever you subscribe to your podcasts. Join us next time to hear more insights and ideas from leaders in the disability world.